Good morning. Holly, can you let me know if you can hear me okay? Send me a quick text.
Yep, I can hear you just
All
fine
right,
there.
perfect. I apologize for that pause there. Good morning, everyone. My name is Barb Rabe, and I really appreciate you joining us this morning on our presentation of Understanding Medicare. I apologize for any technical issues or any delay there. I've done many of these workshops, and I will be very honest, this is my first virtual one. So we hope it's a success. I do anticipate that we set it up so that it's going to be easy to follow. Just a bit about my background. I've been working with health plans one way or the other for about 35 years and helping people specifically with Medicare since 1996. In 2015, I merged my own agency with Town & Country Insurance, and I'm really proud that we have a team of 3 licensed and certified agents on board. We take a lot of pride in helping people navigate the Medicare process and understanding their options when they become eligible. Holly Alleman, another licensed and certified agent here at the agency, is one of my teammates, and she will be monitoring and co-hosting this webinar this morning. So on that note, it's my hope you find this engaging, informative, good use of your time. As we indicated in the earlier slides, please feel free to use the chat feature if you have questions. If you would like to verbally ask us a question, we will unmute the lines at the end of the presentation. So just one disclaimer before we start. This is what we call an educational presentation. We will not be discussing plan specifics during this webinar, nor am I going to be addressing programs like medical assistance. If you want specific plan specifics, we absolutely will help you with that, but that would be a separate meeting at your request, and we can discuss that in a private manner following the webinar. So, Holly, I think we're ready to get started.
Yes, I'm excited about this as well.
Thank you, Holly. And you can hear me okay?
Yep, I can hear you just
Perfect.
fine.
Okay, thank you. So our goal this morning is 2 things. We're going to simplify Medicare, and we're going to teach you to learn to make informed decisions. On our agenda this morning, it's pretty simple. We are going to show you or go over some basic Medicare facts. What is Original Medicare? Reviewing what Original Medicare does not cover, and enrolling timely. So we're going to start. We have a few trivia that we built in to try to make it a little engaging. What year was Medicare passed into law? We've got a couple of options to let you ponder. Was it 1945, 1955, 1965, or has it been around just since 1975? So let you think about that for a second or two. And we're going to show you a picture of a president on the next slide, which gives it away. Lyndon B. Johnson. This is an infamous picture of President Lyndon B. Johnson signing Medicare into law in 1965. So it's been around for 55 years now. Basic Medicare facts. So what is Medicare? Well, Medicare is a government health insurance program. You sign up through the Social Security Administration. You're eligible at age 65, even if you don't retire. Some folks get it under age 65 if they've got certain disabilities and if they're eligible and drawing Social Security benefits. It's administered by an agency we term CMS, which stands for the Center for Medicare and Medicaid Services. And again, this is a federal agency. A few more facts about just basic Medicare. It's basic, affordable insurance. Most people look to private companies for additional coverage. Medicare was first created in 2 parts, Medicare Part A and Medicare Part B. And together, this is called Original Medicare. Some folks, or it could be termed Traditional Medicare, but in most written materials, you'll see that as Original Medicare. There are possible penalties if you don't sign up for certain parts timely, and we'll talk about that later. Some folks do delay Medicare without penalty if they're still working and on active group insurance. This is a picture, a sample card we found online about Medicare. Most of you have ID card. Most of you have probably seen this. your full names on top. They changed the Medicare ID number several years back now under the Obama administration. They were ordered to take off Social Security numbers and have randomly selected numbers, of course, for privacy and security purposes. And you'll see that this is a card that has only Part A and Part B. This is issued by the Social Security Administration. Just a little comment about this card. We found this online. It's very commonly used for these purposes, but Medicare always begins the first day of the month. So I don't know why this one says March 3rd, but you get the idea. So number 2, we've talked about Medicare A and B. That's called Original Medicare, but there are other parts to Medicare. Kind of some people call it alphabet soup. Is it C, is it D, or is there both a C and D? And the answer is, here's our puzzle, A, B, C, D, C and D. And we will talk about Medicare Part C and D. Those are the private parts of Medicare. So let's go back to Original Medicare. So you've got this red, white, and blue card. You've got the Medicare Part A. Well, what does that cover? People say, well, what is this going to do for me? Well, Medicare Part A, you'll see the visual there of the hospital. What Medicare Part A covers or helps cover is inpatient hospitalization, some skilled nursing facility, hospice, and some home health care. It's free for most people if they've worked 10 plus years of Medicare covered employment and they're eligible for Social Security benefits. So Medicare Part B, now you see the little cartoon character of the doctor with the stethoscope there. Medicare Part B is, I like to think of it as the people services. It's the doctor, other provider services, many preventive care services, diagnostics, x-rays, supplies. That's just to name a few. Now Medicare Part B has a premium. And if you're drawing Social Security, that premium is auto-deducted from your Social Security check. If you're not drawing Social Security, you will receive a bill from the government, and generally it's in a 3-month increment. So there is a premium with Social Security, with Medicare Part B. Important to understand that when you're calculating costs. And let's talk about what that premium is. So that brings up my third trivia question. Every year this number will change. We find out in the latter part of the calendar year. In 2020, what is the standard premium for Medicare Part B? Is it $99.50, $144.60, or $187? You get 3 of them to choose from there. And the answer is $144.60. Last year it was $133.50. We found out in the latter part of 2019 that figure would be $144.60 for 2020. Now, I put a chart up on this slide. You'll see to the left there's a grid. You have to understand that Medicare Part B is means tested. What that means is that if you are in a higher income category, you will get a letter from the Social Security Administration that says you may have to pay a higher Part B premium. And it's a 2-year look back. So if you look at this chart here, if your yearly income in 2018 was, for an individual tax return filer, $87,000 or less, you're going to pay the standard. You see that $144.60 over in the top row, last column. If you're married, filing a joint tax return, you'll see that threshold to stay at the standard premium is $174,000 or less. And then you can see if your income was higher, you'll see on that very last column that those figures do go up. The maximum would be $491.60 per month if you, as a single tax filer, earned $500,000 or less in 2018, or $750,000 as a joint tax return filer in 2018. So we've talked about Original Medicare, given some very basics on what it covers, A and B, but what might it not cover? You know, why do people look to other companies? So there's deductibles with A and B. If all you carried was this red, white, and blue card, for example, on a Part A, if you had an inpatient hospitalization, you would have a $1,408 inpatient deductible per benefit period in 2020. Part B also has a deductible of $198 per year, and most Part B services are 80/20, meaning that Medicare would cover 80% of allowed charges. You would be responsible for 20%. Medicare, original Medicare also does not cover most prescription drugs. That's why people, again, look to private plans. It does not cover an annual physical exam. They do cover wellness, but not an annual physical. Doesn't cover glasses or hearing aids. And most healthcare outside the U.S. is not eligible under Medicare. So again, that's why people look to private plans to fill those gaps. So now that brings us up to about these private Medicare plans. And I'm speculating that most of you, if you're aging into Medicare, are probably receiving a fair amount of mail, because most plans that know someone's turning 65 within the next 6 months to 12 months do like to market their materials and talk about what private plans they can offer. So where you reside determines what plan you're eligible to consider. The state and the county, very critical on what's available to you. This is something that's very near and dear to my heart. When I counsel people, I feel it's extremely important to understand the type of plan you may be interested in. Not just the insurance company or the benefits, but the type of plan. And we'll talk about that in a minute. And that's, here we are, types of private Medicare plans. So there's 4 of them we're going to talk about. The first one, you've probably heard the term Medicare Supplement. Then we're going to talk about Medicare Advantage, Medicare Cost, and Medicare Prescription Drug. 4 plans that we're going to address at this time. So Medicare Supplement. Medicare Supplements are also known as Medigap plans. These have been around, since Medicare came into being. A Medicare Supplement is a medical-only plan. There's different types of plans available. They're standardized, but it's medical only, meaning no pharmacy. It always pays secondary. Medicare would be your primary insurance. Your Medigap or your supplement would always pay secondary. Generally, it's not network-based. This means that if you see a doctor that accepts Medicare, you don't have to worry if he accepts your insurance company, because Medicare is your primary insurance company. It's portable, and this is really an important feature. If you came to me, for example, and you were discussing different options and you shared that you were considering a move. You have a home in Florida, you may retire, make Florida your home of residence in the very near future. This is something that I would encourage you to discuss and consider, because a Medicare Supplement is portable. You have to be a resident of the state in which when you enroll in your plan, but if you have a Medicare Supplement, you can move within the U.S. and take it with you. It's guaranteed renewable, really an important term. It's an insurance term that means that the benefits will not change. So if you buy a Medicare Supplement or enroll in a Medicare Supplement, you will not get a notice each year telling you that your benefits, deductible is going to be higher, you're going to have a copay for this. No, the benefits stay the same. So if you like stability, you don't like change, this is a plan that you may want to seriously consider. The premiums could change, but not the benefits. After 6 months of Part B, you may have to submit a health application. The best time, or a really good time, to enroll in a Medicare Supplement is when you're first eligible for Medicare Part B. There's a window of time at 6 months from when you have your Part B date effective that there's no health questions asked. You can apply later, but you may be asked health questions and be subject to what's called medical underwriting and approval. Now we're going to go on to Medicare Advantage. Medicare Advantage, also known as Part C plans. You don't see that Part C on a card, but that's what they are. And it's an all-in-one alternative to Medicare. It's kind of some people term it as a one-stop shop. It bundles your A and B and usually the prescription drug benefit. You don't use your Medicare card if you have Medicare Advantage. It's like having private Medicare. You're in the Medicare program, you're paying that Part B premium, but you're gonna, if you seek services, you are going to leave that card, at home, tucked away in your dresser drawer somewhere because you will not use it. Medicare Advantage does not supplement, it replaces, so that is the only card you would use when seeking services. Plans vary by state and county. This is not guaranteed renewable, so this means that you will get an annual notice of change. They're year-to-year plans. Every year on October 1, if you're enrolled in a Medicare Advantage plan, you will get a letter. It's actually more of a packet type letter telling you that if your plan's available for the upcoming year, what changes, what premium changes, what benefit changes are going to happen, and then that would take effect the first of the following year. Medicare Advantage plans are attractive to a lot of people because they're not just a medical plan. They may offer vision, hearing, dental, additional benefits. I kind of call it the bells and whistles, and that's attractive to a lot of people. Medicare Cost. So this is our third type of plan. These plans are a hybrid. Hybrid meaning a kind of a combination. It's a little bit of supplement, a little bit of advantage. Medicare Cost plans have they've been around probably the least amount of time. They are very flexible because they can be a medical only plan, or you have that flexibility to include the Part D prescription drug benefits. Your choice. You retain your original Medicare. So unlike an Advantage plan, you will still you'll still carry that red, white, and blue card, and the benefits would be coordinated. The plan availability depends on your state and county. And this is very important to understand because there was a big disruption in the Medicare Cost market in Minnesota. Back in 2018, they went away for 66 counties. 21 counties remain eligible to sell and renew those plans. And we're very fortunate in the area that I work in, Pine, Aiken, Carlton, Mille Lacs, St. Louis, Kennebec. Cost plans remain available, and they are an attractive alternative because of the flexibility and how the benefits are designed. So if you're in one of the available counties, it is one that you would want to really look at and consider as one of your options. It is a year-to-year plan. So like an Advantage plan, it is year-to-year. There's no guarantee that it will be available the upcoming year, and the benefits can change. You will get that notice of change by October 1, reminding you that open enrollment's about to begin October 15th, and these are the changes for the upcoming year. You will also, most cost plans give some of the bells and whistles, so to speak, in terms of vision, hearing, and dental. It may or may not be offered. It would depend on the plan. And then the fourth type of private plan available on the market are Medicare prescription drug plans. And these are known as Part D. And I'm sure most of you have heard that term, Part D. A lot of times you'll hear it on television advertising, perhaps from a pharmacy, what's your Part D benefit? We offer, low copays or whatever. But Part D is the pharmacy part of Medicare. And this has only been around since 2006. So Medicare, was signed into law in 1965, President George W. Bush signed Medicare Part D into law in 2003, and then it took effect January 1st, 2006. And it added a benefit that had never been available to Medicare beneficiaries. It can be sold or you can enroll. It depends on different scenarios, but it's sold as a standalone plan, which means that you enroll in a private prescription drug, or become PDP plans, and that card is all you use it for is at the pharmacy. Or it's included or bundled. We like to use that word bundled with certain plans. Like I earlier mentioned that Advantage plans and cost plans can include the Medicare Part D benefit. The plans will vary by state and county. Again, when we help people evaluate programs, the first thing we do is, what state do you live in? Obviously, we have to be licensed in that state, but what county, what zip code, all those things we look at when we first begin discussing, or anyone that would be discussing this, or if you're doing it on your own. Very important to understand that plans will vary by state and county. There's coverage levels and what's called a donut hole, and you've probably heard that term, donut hole. It's been made fairly infamous, but it's changed since 2006 significantly. And I'm going to show you a little image in just a moment here of how these levels work and what the donut hole actually is. And this one also, year-to-year plan, is those that have a Medicare Part D coverage will get an annual notice of change. That change is required to be sent to beneficiaries by October 1st each year by the plan. And then October 15th, the open enrollment begins, or what we call annual enrollment period, so you can reevaluate. You can certainly stay with the same plan if it meets your needs, but there are options for you to shop during the annual enrollment period. There is a penalty. A lot of people ask this question. So Medicare Part D has a window, and we'll talk about that initial enrollment window when you first become eligible. But if you do not sign up when first eligible, you've delayed, you say, I don't take meds, I don't need this coverage, and that, it's optional. You don't have to sign up for it. But if you elect not to go with Medicare Part D when first eligible, and later on down the years, you sign up during an open enrollment or an annual enrollment window, Social Security will know that, and they will send you a letter asking if you have, by chance, other coverage, maybe VA or what they call creditable coverage. And if not, you can still sign up during an open enrollment window, but you will be assessed a penalty, which means you will pay a higher premium. And that is lifelong. We'll talk, there's a little image too I have of the late enrollment and how it's calculated in just a future slide here, a couple slides forward. One thing I always point out to my people that I talk to about Medicare Part D, there's a program called the Extra Help Program, and it's through the Social Security Administration. And what it is a subsidy, not a public program, but it's a subsidy. And it's available to folks with limited income and resources. And there you can go on the Social Security or Medicare site, and they'll give you those specific, the thresholds for income and resources. I always tell people, if in doubt, check it out, because it helps. It can help significantly if you meet those guidelines. So let's talk about Medicare Part D and the levels of coverage. This is a visual of a standard Part D design for 2020. Most plans that I work with do not look like this, but they have to meet at least these minimum coverage requirements to be eligible to be approved to be a Part D plan. So the plans with Part D vary, but this is, again, the minimum coverage that must be provided. For example, some plans may have a lower or a zero deductible or flat copays. Which a copay is a flat amount you would pay on a 30-day supply of medicine or of covered meds in the initial coverage phase. At the bottom is just kind of the Medicare RX, what their symbol looks like on a Medicare Part D ID card. But let's look at this colorful grid here. So if you had a standard Part D design, the annual deductible in 2020 would have a deductible of $435, and that's calendar year. So if you went to the pharmacy, no matter when you started the plan, it always goes calendar year, January through December, you would be responsible for the first $435 of covered meds. Once you satisfy that, and this is all done electronically at the time of purchase, you would enter into the next level of coverage, which is called the initial coverage level. And at this point, on a standard Part D design, you'd pay 25% of covered meds. The plan would pay 75%. This is until the total cost of the drugs that you're purchasing in that year reach $4,020. When I say $4,020, that's between what you pay and what the plan pays. So if you had say a $500 a month med, and you had to pay, 25% of that, the insurance company was paying 75%, but the med, that $500 overall cost, is what counts toward that $4,020. Now, as I mentioned earlier, many plans do not have this plan design. They make the benefits more attractive, but this is the minimum. Now, if your meds, overall cost of the total cost of the covered meds exceeds the $4,020, you enter into that next level. We're moving up the visual here into what's known as the donut hole or the coverage gap. Now, on a standard plan, you would remain paying 25% of eligible drugs, both generic and brand. You will get, people that are on Part D plans receive a monthly report from their plan with information on any med that they filled previously. So they will keep you informed of where you're at in relationship to the coverage gap or the donut hole. So there's no sticker shock when you walk into the pharmacy one day and perhaps you had to pay more. If the gap will end once the out-of-pocket threshold of drugs hits $6,350. And at that point, you'd enter into the very top level, which is called catastrophic. So there would still be a 5% responsibility for eligible drugs. It never goes to zero on a standard Part D design. My recommendation for people evaluating Part D plans is to work with a trusted advisor. There's wonderful tools through Medicare.gov. There's other tools that we can use, or an agent or the senior linkage line, trusted advisors that can help you look at your specific needs so you know what options are available to you based on your county and what your anticipated co-pays or co-insurance would be, making sure that your pharmacies are accepted by that plan, whether you would anticipate hitting the coverage gap. So many things come into this, but there's some wonderful tools available, and we would really encourage you to work with a trusted advisor for that assistance. The extra help that I had mentioned earlier for those on limited income and resources, again, is through the Social Security Administration. It helps cover things like monthly premiums, annual deductibles, and prescription copays. And for help applying, you can contact the Social Security Administration, the state Medicaid office, the senior linkage line. You can also go online, and I did put the website there, ssa.gov/extra-help. Now that late enrollment penalty, I always get a lot of questions on that, and I don't want to make it confusing, but so if you choose not to enroll or miss the deadline and later on you're assessed a penalty, what Social Security does is they take 1% of the average monthly prescription drug premium across the country. And then they multiply that figure by the number of months you were late. And then that amount is your penalty, and they inform the insurance company that you do sign up with them that you have to pay an extra amount. And that can add up. I have had a few folks over the many years I've worked in this business that, went for many years without Medicare Part D. I think I had one that went 10 years. And so it was 120 months that she went without Medicare Part D or did not have what they call creditable coverage. So the 1%, and I think in her situation, and I can't quote the exact figure, but it was somewhere between 30 and 35 cents. But when you take that figure, it doesn't seem very large, but when you multiply that by 120 months, say for example, at that point I think it was like 33 or something like that. If you take 0.33 and you multiply it by 120 months, she had an extra $40 a month. So if she bought a plan that was $30 a month, she had to pay $70 a month, and that would have been billed right from her insurance company. So the takeaway from this is really work, again, I would encourage you to work with a trusted advisor to make sure that you're seriously considering Part D, to the penalty doesn't come back and haunt you, because it is a lifetime penalty. I mentioned the word creditable coverage, and what creditable coverage is, it's drug coverage that's expected to pay on average at least as much as Medicare standard. So group insurance oftentimes meets Medicare. exceeds Medicare standard would be creditable. TRICARE, VA, Indian Health Services are examples of creditable coverage, meaning there would not be a penalty if you later signed up. So our last trivia question, we've talked about 4 types of Medicare plans, private Medicare plans: supplements, Advantage, and cost plans. These are the 3 medical plans. Which plan is the one that would be guaranteed to renew year after year? Give you just a second to think about that one. Medicare Supplement. And I put a visual on here. This is the booklet that's sent out by CMS and the National Association of Insurance Commissioners, or known as NAIC. It's a guide for health insurance for people with Medicare, just on Medigap. This is the 2020 cover. I got a visual of the cover of that booklet. So Medicare Supplements, also known as Medigaps, do have that guaranteed renewable feature. So, okay, so now you've given me all this information, Barb. What am I supposed to do? Where do I begin? Hopefully it's not more confusing. Hoping that this is all gelling and that it makes sense to you. These people are, the lady's smiling, so I'm hoping that it's clear to her. But let's talk about your options. And then I'm going to give you some suggested thoughts as you evaluate your own situation. So remember, the plans that are going to, the type of plans, this is not, again, company specific, but the type of plans are going to depend on your state and county. So option number, like door number 1 or option number 1 would be, yep, you're in the original Medicare plan and you choose a supplement. Maybe you want to just stay in original Medicare, you don't feel the supplements of value to you, and you go with a drug plan. You can pair it with just a PDP or prescription drug plan Part D. Maybe you want all 3 for very comprehensive coverage. You got the original Medicare, you do the supplement, and then you pair it with a drug. Cost plans. You live in one of the 21 counties in Minnesota that offer cost plans. You've taken a look at the options. You're really attracted to that. It meets your needs. That would be an option. And you might want that cost plan that includes the drug coverage because it covers your meds. You can go to the pharmacy of your choice. You're good with that. You like the simplicity of that bundled cost plan. Or maybe you want to get that cost plan because you love the medical benefits, but you're thinking, or with the help of a trusted advisor or with your own evaluation, you've determined that a standalone prescription drug plan is in your best interest. You've found lower copays, maybe you don't like that bundled plan. You just want to have a separate card for your pharmacy. And that is an option with cost plans. Another option is you like the Advantage. You like the idea of having that one-stop shop. And maybe you're a veteran and you get your meds to the VA, for example. So you're going to go with a Medicare Advantage plan, medical only, because you have creditable drug coverage. Or you love the Advantage plan. You found one that covers your doctors, covers your meds. You're just going to go straight with what we call an MAPD, Medicare Advantage plan with prescription drug. So lots of choices here. But first things first. So we're going to set that aside just a quick moment. Go back to our Medicare red, white, and blue card. We want to make sure you've got that in place because that's the first thing we have to ensure when we help people or if you're considering a plan. Do you have your A and B set up? So if you need to apply for your Medicare benefits through the Social Security Administration, if you're not already drawing Social Security benefits. If you're drawing benefits, it's easy. You can check that one off your to-do list because it's an automatic, the card automatically arrives about 3 months and 10 or 15 days prior to your birthday month. It comes in a big white envelope. It's, I don't know if you've seen this, but it's like perforated in the upper left-hand corner, and that is your, that is your red, white, and blue card. Again, 3 months prior. But if not drawing, you do need to take action. If you're worked for the railroad, you do contact the Railroad Retirement Board, not Social Security. I think most railroad retirees would know that. So to get enrolled in Medicare, you can call the toll-free, the national number, the 800-772-1213. If you're up here like in the Pine Carlton County areas, St. Louis, Mille Lacs, Duluth services most of this area, 1-855-863-3560, or go online. Really not hard to do at all, and I gave the link at the bottom there, or I'll be glad to email that out to you too. It's only a 5-10 minute process to get signed up for your Medicare A and B. So you need to do this during your initial enrollment period. Do not miss your initial enrollment period, and I'm going to give you an example of how that works. So it's 7 months surrounding your 65th birthday. And the birthday example I gave here is somebody who was born September 15th, 1955. So when does he do this sign up? Because he's not drawing Social Security. Well, he's got the months of June, July, and August, the 3 months prior. And if he signs up for his Medicare, then his coverage will begin September 1. Even if his birthday is September 15th, it will begin September 1. Now, it is a 7-month window. So if you delay, you still have the month of your birthday, September, October, November, December. You can still enroll, but they will push out the effective date. I always recommend doing it the 3 months prior. And if you're going to do it online, I don't even believe they allow you to get in. Like in this case, it would be June 1, yesterday, if your birthday was in September, that you could go and sign up for your Medicare A and B. So I have a slide here that says any questions on the information discussed so far. And I know our lines are muted, so I just, maybe jot them down, chat them into Holly. Just keep those in mind, and we want to make sure that they're addressed. And again, we will unmute the lines at the end. Okay, so now, what do you need to think about? Get the guy scratching his head there. Okay, what do I need to think about when I choose a plan? What questions do I need to ask? Well, you need to understand the costs, obviously, coverage, what other coverage might be in force, how the simplicity and the extras that may be offered by a plan, the prescription drug, doctor, hospital choice, and travel. Those are some of the key ones. Certainly it's not all the questions, but it's the key ones. So when you consider costs in a plan, make sure that you're clear on the premium, the deductibles, copays, and if there's an out-of-pocket limit. Out-of-pocket limit means that if you did incur eligible expenses, what is the maximum you are financially responsible for? Do you want a higher premium and predictable costs? Or do you want a lower premium and quote-unquote pay as I go? Some people that tell me, gee, I'm really enjoying good health. I don't do a lot of doctoring. I've got some, I've got some reserves. I would rather just have a lower premium. I can handle those co-pays or those responsibilities if I do have claims. It's a personal decision. Coverage. Make sure that when you're considering a plan, you understand the benefit structure and what if you change your mind. If you work with a trusted advisor, they will make sure you understand, when you can make changes, the type of enrollment windows and periods and special enrollments that may or may not be available to you. Do you prefer the stability of the coverage year after year, or are you comfortable with reviewing benefit changes yearly and possibly making a plan change? If you recall, we talked about that term guaranteed renewable on the med subs. In my experience, I have found that people that are in a position to handle, sometimes they're a little higher premium, the Medicare supplements, depending on which one you choose, of course. But some people that say, I don't want to deal with open enrollment on my medical. I just want to know it's there for me. They will say, I want that stability. Other folks say, I've been through open enrollment for years. I'm comfortable. I'm used to reviewing my benefit changes. I will pick up the phone and call, if they use an agent or a trusted advisor and make a plan change. I'm good with that. Your decision. Other coverage. Are you going to continue working? Do you have employer insurance available to you? Group, maybe a retiree plan. Do you have coverage to the VA or TRICARE, for example? All considerations when choosing a plan. Simplicity and extras. So do you want that plan that's all in one? So you deal with one company for both your medical and drug coverage and just have one customer service number to call if issues? And are you looking to add the extras like hearing aids, eyewear, dental, gym membership, for example? How important are those to you? Prescription drugs. Have you looked up the meds on a plan's list of drugs? Any plan, and I'm talking about the insurance plan, that offers a Part D has to have a list of drugs approved and offered that's called a formulary. You make sure that your meds, you've looked them up. If they're not on the formulary, you need to look at options during either the open enrollment or when you're initially signing up. Also, some meds might require a prior approval or have restrictions for specific meds. One comment on that earlier thing, I said the plan's list of drugs. There are formulary exceptions, but if you're new, that you can submit a request for, not guaranteed to be approved by the plan. But when you're new to Medicare Part D, just a really good idea to have a very thorough evaluation done of your meds to avoid issues. Do you understand the levels of coverage and the donut hole? Might you be in a position based on your specific meds that you may hit that donut hole? Do you get the extra help subsidy? Because if you do, your benefit structure will change. And can you use your pharmacy? And I'm seeing this as a bigger and bigger issue over the last several years. A plan that offers a Part D plan will have a network of pharmacies that they contract with, and within that, they may have preferred and standard. And that's very important to understand because you want to use preferred pharmacies to get the lowest copay or the lowest cost on your specific med. And that can change every year. And might you have a late enrollment penalty? Doctor hospital choice. Can you keep the doctors you currently use? So when you're evaluating your options, make sure that you've considered the doctors and your preferred providers, maybe hospitals. Does the plan have a network? If you choose a Medicare supplement, there generally is no network. Any doctor that takes Medicare. But if you are in an Advantage or a Cost plan, they will have a network of healthcare and hospital providers, and they need to be looked up. They may have out-of-network coverage, depends on the plan you're considering, but you want to be well informed before you make your choice. Does the plan require referrals? And travel. And being that we're in a northern state where I have a lot of snowbirds that I've worked with, I've seen this a real big issue, and it's important to understand. If you take frequent trips, either domestically or internationally, remember original Medicare is U.S. coverage. So most plans that I see that the private plans will offer some emergency internationally, but you need to truly understand how your coverage will work if you travel, especially if you spend a considerable amount of time out of your home state, like wintering in Arizona and Florida. Some plans may have a travel benefit, or they may have access to a national network, or they may just have higher expenses with out-of-network benefits when you are out of the area. So again, these are questions you need to evaluate when you're choosing a plan. The annual enrollment period. So this is in the fall. That's why we have our little colored leaves there. Annual enrollment, we call it AEP, or some just call it open enrollment, but it's technically AEP. And this is our busy time of the year. It runs from October 15th to December 7th. It's like a 7-week window. And during that time, you can make changes. Your notice of plan changes arrives in your mailbox by October 1. And you can begin, for example, if you're working with an agent, the agent is allowed then to start discussing what's going to happen with the plan changes October 1, not prior to October 1, but only on October 1. And then if you do choose to evaluate or enroll in a different plan, you can do that beginning October 15th. That runs through December 7th, and then those plan changes would take effect January 1st of the upcoming calendar year. Special enrollment, SEP. Special enrollment are they're for like unique situations. They're year-round. In special circumstances, moving, loss of other coverage. There's been some special COVID-19 SEPs going on right now because of the national health crisis. Those need to be discussed individually with Medicare with a trusted advisor because there's windows of time involved in those and you don't want to miss out. The biggest one that I personally see, or there's two of them that I see on a fairly regular basis, is people moving. Maybe they're moving to another state to be near their kids, or they've decided to move to their winter home down south. The other one I often see is people that have worked beyond age 65 and now they're retiring. They're 67 and they're retiring. So we have an SEP now, and those again need to be addressed individually. So where to get help? So we have some resources here. For the prescription drug extra help information, we have the senior linkage line, which is free insurance counseling in Minnesota, the 1-800-333-2433 number. There's actually, each county actually has a specific senior linkage line, a rep, but this is the main number. SSA, which stands for Social Security Administration, you can certainly call their number and they can get you the extra help information. Again, that's based on limited income and resources. I'm with Town and Country Insurance. I office actually out of the Hinckley area. We serve a pretty large area in Minnesota and also parts of western Wisconsin. I mentioned there's 3 of us, and I'm really proud, and we just have a great team effort. Myself, we've got Jenny Olander. Jenny's got, I think she just had her 16th anniversary with the agency, and then we're so pleased to have Holly join us. Holly comes from a pharmaceutical background, has some great experience with Medicare Part D, and she's the one that's co-hosting with me this morning. So our phone numbers are there. And there we are. Pictures. I'm the one on the left, dark hair. Jenny, always a big smile on her face, and then Holly, and she's online with us this morning. Those are our team of 3 at Town and Country. We all have the same goals: to serve our customers to the best of our ability and make sure that if we're in a position to help someone, we want to make sure it's the right plan for you, and we want to make sure that we're available to help you from year to year. That's just our goal. There's our little logo. So questions. Holly, can you unmute? And I don't know if there's any chat questions at all, but if it's a general question, maybe, yeah, is there any chat questions, Holly?
No, there is not. There was one about a formulary, but that one had been taken care of.
Okay.
So I just unmuted all the lines if anyone would like to speak.
Does anybody, feel free. We don't want to certainly address anybody's private health information. We can do that later. And I don't know if I went into enough depth. Okay.
Just to confirm, if we're already drawing Social Security, we're not required to do anything regarding the Medicare, and that it will automatically come 3 months prior to my 65th birthday. Because I was always told you had to do something 3 months before you turn 65.
Not if you're drawing Social Security. So, for example, I gave that, and I don't know what month your birthday is, but I gave the example of the person who has a birthday September 15th. So take that month and then back up 3 months. So in that case, it would be August, July, June. That person who had a birthday in September probably just got his or her card by the end of May. And you don't miss it, because I know some people have missed it because there's so much solicitation that might arrive in your mailbox as you approach 65, but it comes in a bigger white envelope. And I believe it's from the Department of Health and Human Services, if I recall right. And when you open it, it's on hard stock paper, and the red, white, and blue card is in the upper left-hand corner. It's perforated. And if you don't see, now I did hear it, a little side note. I got an email one day that said they were a little bit delayed because of the COVID and some of the craziness going on right now. But in all the many, many years, it's 3 months prior. And if you don't see it, then call Social Security and say, where's my card? And again, I can give you those numbers if you didn't jot them down. Anyone else that would, general question or question on Part D or formulary or anything?
This is a question, this is Carrie.
Hi there.
This is really speculation, but just when you're looking at plans that have a year-to-year adjustment,
Okay.
they're sort of speculating that 25 years from now or something, Social Security benefits are going to go down because the fund is going to have less money available. Do you see, with the changing situation in health stuff and with COVID-V, that you could be in one of those plans with a year-to-year and you might end up being penalized or have costs that you couldn't anticipate that simply won't be as much available as it is now?
That's a really good question, Carrie, and I don't even know if I can answer that question. And I see where you're coming from. Your concern is that if you don't lock into, let me rephrase this. Is your concern that if you don't lock into like a Medicare supplement, the year-to-year plans might just continue to grow in like cost sharing and financial responsibility?
Precisely.
Yeah. Good question. And I don't know. I wish I had a crystal ball. I have seen a lot of stability in the plans. Again, you've got that 6-month window to enroll in a Medicare supplemental plan. You can always go from a supplement during open enrollment to an Advantage or a cost, if a cost plan is available. What you may not be able to do is the flip, because there is subject to medical underwriting if you want to lock into like a Medicare supplement. But yeah, so I just don't know. I wish I had an answer to that. It's a really good question, and we could talk about that individually too. I think I know who you are, so hi, Carrie.
Okay.
Yeah, good question. Sorry, I don't have a good answer for you. Anybody else? Feel free, again, unless it's private. Was it helpful? Can anybody, I love feedback. This is, again, my first virtual one. I've done many, probably hundreds of these and face-to-face, and it's a little bit of a challenge for me to not see your friendly faces and not be able to have conversation and share stories and coffee and cookies and all those fun things I do when I do in-person meetings, that I just wasn't able to do them now.
You did an awesome job. Really, really made it very clear. Very awesome job.
Thank you.
Yes, can you hear me? This is Lynette, but I'm in the team under fire.
Oh, I can hear you.
Oh, yeah, okay, great. I wanted to also just second what the past person's comments were about how well this presentation was done and presented. The only thing is, in some areas you moved a little quickly. I was trying to take some notes and I kind of ran out of time, but that's okay. I wish, you are going to send out notes? I think I understood.
We can send out the slides. Yep, we will, as long as you share. Yep, absolutely. Because if I had had it in person, I would have given you a copy of all the slides.
Yeah. Oh, okay. So that's fantastic, because I'm new to all this. I'm a little intimidated by it all. I'm going to talk to my sister who has already been through all of it and try and get some advice from her as well. My husband and I are not planning on staying in this state. Long term, we do plan on moving to Arizona, not doing the snowbird thing. So that portion of moving was important to me. But yeah, so I just turned 64, so I will be signing up, obviously. But thank you. You really did an excellent job. I appreciate it. And it was easy being in my living room on my screen with my cup of tea.
Well, and feel free, Lynette, to call us. Again, we do one-on-ones when it comes to people's specific concerns, but it has to be at your request. It's just a compliance rule.
I understand.
And the reason I kind of go quickly is because I try to limit it to an hour. I have found that when I go over an hour, it just is good to limit it to an hour. So
I understand.
You lose people.
Well, it does, and people have other things going on in their life. So, but we will absolutely do one-on-ones with people if you just, we just have to do it at your request. So, because we just want what's best for people. Yeah, and we appreciate those of you with feedback and participation. That's Medicare. I've been in this business for a long time, but Medicare, I'll be honest, is my very favorite part of the insurance world. I just really enjoy helping people, and I know Jenny and Holly feel the same way. So give me a call, and we'll help you out.
Okay, fantastic.
Any other questions or concerns, or do you need any contact information, or?
One more question. This is Carrie again.
Okay, Carrie.
Sort of the next step of as you've presented types of plans, not company, is there a website, or is it senior linkage, or what would be a good place to sort of look at all of this information for those of us who take things in well in a written form?
Medicare, well, our go-to for prescription drug and Medicare Advantage and cost is Medicare.gov.
Okay.
www.medicare.gov, and you can enter your zip, you can enter your specific meds, you can choose the pharmacy, and then it will sort through every plan available in your geographical area. What it will not do, Carrie, is do the Medicare supplements. Medicare supplements are not regulated, and it's not regulated, I shouldn't say that, but they're not subject to these contractual arrangements with the Center for Medicare. So you can't line up like a Medicare supplement that won't be on the Medicare.gov, but it does give you, it's a great resource. I've used it for years. It's one of the greatest websites really I've used in my career in insurance. Is really good. And if you came in, or if I worked with you one-on-one, that's probably what I would pull up. I'd say, you know what? We've also got some decision guides that we could share with you, but they are from some specific insurance companies. But upon your request, I'd be glad to send them out. And they have some pretty neutral information in there. So they're maybe sponsored by, ABC company, but they're pretty neutral. So we'd be glad to send out some of those decision guides or step-by-step guides.
Okay, and then also, Barb, are there other, so I'm turning 65 July 12th, and I have done my registration process. It's supposedly starting the 1st of July. Are there other things that would get a penalty into place if it's not done in a timely fashion?
Yeah, good question, Carrie. So Medicare Part B, you've got that lined up now when you turn 65. Yes. Medicare Part B has a penalty for those that delay Medicare Part B, and that's really tricky. That's assessed by Social Security. So you're good there, and then the other penalty would be Medicare Part D. So if someone had a birthday in July and you're eligible July 1, you would want to make sure that you were in a Medicare Part D plan within that 7 months. And so if your birthday is July, you'd have through July, then August, September, October.
Okay, to get the Part D in place.
Yep.
Okay.
Yep.
All right. Okay, thanks so much, Barb.
You are welcome. Everyone, thank you, thank you. We will send out the slides, and let us know if we can be of assistance, and have a wonderful day. Stay healthy, stay safe. Holly, do you want to say bye?
You too.
Goodbye.
Okay.
Thank you all for joining us.
All right, take care, everyone. Bye now.
Bye-bye.
Bye.